going to talk about tummy tuck. Tummy tuck is a description that has really quite a broad range of procedures attached to it. But broadly speaking, people who come to see me regarding their abdominal area have a number of possible different problems. One may be some excess of fat, which may respond perfectly well to liposuction, or alternatively, they may have had their tummies ravaged by pregnancy. Similarly, because of the extent of pregnancy, obviously twin pregnancies or multiple pregnancies are going to make this worse. The skin may stretch very greatly and not really take up very well after pregnancy once everything has subsided. The other group of patients who come to see me are those who have lost a great deal of weight, and they therefore have folds of skin, possibly some excess fat, but certainly folds of skin held up at the tummy button and then an apron across the bottom of the tummy, which is a problem for them and which they're finding difficult to cope with, particularly if they've lost a lot of weight and really they're left with something that is still bothering them, but in a completely different way. Clearly, those things are not going to be reversible by exercise or anything like that. If the problem is really just confined to the area between the tummy button and the top of the pubic area, with perhaps some fullness, some excessive skin, that can be dealt with by a procedure called a mini abdominoplasty, a refashioning of the tummy area. If the initial analysis is that tissues are going to need to be addressed round the back, or extending onto the back, or all the way round, if an operation is carried out all the way around to tighten things up, it's called a trunk reduction, or alternatively, if it goes beyond the flank areas just somewhat round onto the back, it's called an extended abdominoplasty. Sometimes surgery of this kind is accompanied by liposuction. Is this a very painful operation? Well, you will need some pain relief following surgery by way of tablets at home. But I find that most of my patients don't need to take really very much in the way of pain relief once they've been at home, perhaps for 3 or 4 days. Abdominoplasty, a full abdominoplasty with extension or even a trunk reduction, is quite an extensive procedure and it takes quite a lot out of you. There's obviously an emotional build-up beforehand, the expectation of what's concerned and so forth, so there's some ripples in the pond from that point of view afterwards. In addition, there's the physical aspect to just gradually recover from. And some of my patients may find it's perhaps even up to about 6 months before they say to themselves, yeah, I feel 100% again. But that point does come. It's just a question of patience and just travelling along that journey until that point is reached. With regard to possible problems, complications from surgery, obviously we think about giving a general anaesthetic very carefully. No general anaesthetic is completely risk-free, which is an important point to take on board at the consultation and think about carefully. Bleeding following an abdominoplasty is very uncommon, but obviously would be attended to if it were to occur. An infection is also very uncommon and is guarded against not only by very careful attention to aseptic technique, that is to say keeping everything as clean as possible at the time of surgery, but also by giving an antibiotic to cover the procedure and for a few days afterwards. Surgery of this kind really does make a big difference. I find very satisfying to do because the transformation in my patients following this surgery is so striking. Very occasionally it's necessary to go back and tidy something up about 6 months after surgery. If there's a slight fullness in the flank, for instance, usually that can be done under a local anaesthetic as a day case and is not a big deal.